Hello, welcome to our segment. Today I'll be addressing the question of donor management, specifically to do with over-harvesting of the donor area. And when I say donor, I'm talking about the back and sides of the head, here and there. That is where traditional transplants derives hair from. So hair is taken from the back and sides and placed in the tendon area. Now that we have follicular unit extraction becoming popular, which is the process by which you take the hair from the head one at a time and you don't leave the line of scalp. But when this procedure became available to a lot of clinics, there were a lot of variables, a lot of unknowns for sure. But there was also a bit of over-enthusiasm on the part of some providers that did not exercise a lot of caution in the way they harvested the grafts. And we had a lot of patients that were either too young for the procedure that will come in demanding that their hairline be placed almost close to their eyebrows, which is not a very good practice in restoring very young patients that way. And also there was an attempt by some providers to restore patients that really cannot be restored using only head hair donor. The head hair just doesn't have enough hair to restore a node 6 or node 7 patient. So you have situations where some clinics will try to do that either because they cannot or do not want to use body hair as a donor pool, because if you have donor body hair as a donor pool, you can add it to the donor pool together with the head hair. You have a vast amount of graft supply, and like we've done in several patients successfully, restore even severely bald patients. But if you try to do that without the ability to harvest body hair donor in a node 6 or 7, you're either going to end up with a very sparse result that just doesn't look credible or natural enough, or you're going to end up over-harvesting the donor. So now you arrive to the donor looks very unnatural and completely desolate, and still not be able to restore the tongue. Now this was going on about 8-9 years ago when we started noticing patients or clinics doing this. And now we're beginning to see these patients trickle into my clinic at least. And I've seen quite a few patients like that, where the donor area just looks completely desolate and ravaged, and the coverage they've received on the top of the head is just not impressive at all. So two things that could have been avoided.
Dr. Umar, this is where you want to be.
If you are doing follicular unit extraction as a doctor, or you are a patient looking for follicular unit extraction for your restoration, and you are node 6 or node 7, you should be looking to use both your head as well as non-head donors. So we're talking about the beard, we're talking about body, all that needs to be put together to give you a result that can look nearly credible. Otherwise, it's better to wait for hair cloning. And I'll repeat that. If you're node 6 or node 7, unless hair cloning is available to your doctor, or they're able to use body hair or beard hair in addition to your head donor supply, you really should not be going down the hair transplant route. This is the essence of this presentation. Otherwise, you're likely to end up in a situation where the coverage is not credible, and your donor or supply of the head is delayed, and now you have two problems: thinning on the top and thinning on the back and sides of the head. That looks very unnatural. So proceed with caution. Thank you.
Here's what you gotta do. Pick up the phone, make an appointment for you. Pick up the phone, make an appointment for you. Pick up the phone, make an appointment for you.